This is a wrist tape job for a hyperextension injury or an instability of the wrist. Hyperextension injury are common with a fall on an outstretched hand. Instabilities are quite common on the lateral side, affecting the cartilage on the outside of the wrist themselves, and instabilities around the medial side are common with any kind of scaphoid injury. We're going to show you a combination of all three, one to block hyperextension, the other is to stabilize across either side of the joint line. You position the athlete comfortably in sitting with the elbows supported on a bench. You start by providing a light spray of skin toughener just around the wrist and forearm. Using Pro-Wrap, just put a light wrap of Pro-Wrap, maybe only 1 or 2 turns around that area. And then you're going to place your anchors. First of all, making sure that you're getting right onto skin. Remembering to finish on the opposite side of the stress. In other words, your anchors are going to be on, or your check reins are going to be on the opposite side. Respecting the shape of the wrist. You're also going to do one through the palm, coming through, pinching through the thumb, coming through the palm without squeezing tightly, so you don't crush the hand, finishing on the top of the hand. And that creates your 2 anchors. So at this point, what you want to do is you want to determine where in the movement into extension that they have pain, and you want to bring them out of that movement and get them to maintain their position, their hand in that position. You're then going to create a fan, and this is going to be your block. Going from anchor to anchor. Of course, the number you would use depends on the size of the person's wrist. I suggest that after you've placed the fan in place, that what you want to do is you want to check to see if they're truly blocked enough. If they feel like they're not blocked enough, you can easily just bring the fan up, take them a little bit more in deflection, place the fan down, and recheck. Does that feel better? Right on. Now what you're going to do is that's your block into extension for that injury. Now what we want to do is provide some support through the joint lines. So you're going to go from an anchor in the forearm and the hand and go across and attach back onto the anchor on the opposite side, making sure that the tape crosses the joint line but doesn't block the thumb. You're going to do the same thing from the medial side, going across and creating the X across the joint there without blocking thumb movement. Making sure you come down and attach right onto the anchor in the forearm. You want to recreate that on the lateral side, going right across the joint line, giving a good tug through and ending on the opposite side. And you want to complete the X by going through, around, and to the other side. So at this point, what you should see is an X on one side, an X on the other side. Now what you want to do is you actually want to close up. So you're going to go back through the palm once, pinch through. Again, remember not to pull too tightly through there, but in this case, what you're going to do is you're going to come around, finish it off there, and fold the other tape underneath to create a block to the anchor so it won't pop. You're going to come back through. You're going to pick up the sticky part there, come back through, and you're actually going to do a figure of 8 around the wrist, locking around and coming back in and finishing on your other anchor. Easy to finish at this point. As you can see, we're just going to continue to do some stability around the wrist, starting and ending in the wrist and closing distal to proximal. More like a traditional, just a straight kind of a boxer's tape job. Making sure you don't put too much compression through the tape, so you're cutting off any circulation to the hand. You want to make sure you go up to at least the point that you placed your first anchor. And you have a good look around for any windows. If you see a window, there's one right here, you can actually just do another figure of 8, or you can actually come through and just fill the window and then finish it off with a figure of 8 through the palm, and that will lock it and make sure it doesn't let go. So coming back through, back around, and ending. You want to check all your tape, make sure it's adhered well down to the skin before testing. You want to check cap refill, make sure there's good blood flow in the fingers. And at this point, what you want to do is you want to get them to check how much they're able to extend, make sure they're able to block that position. You can test yourself, making sure they can't get into the painful position. And with these two X's, one on the lateral, one on the medial side, they'll have still quite a bit of movement into ulnar and radial deviation, but the fact is that they'll feel that the X is stabilizing the joint wonderfully through here.